So I'm going to call the Monday, February 1st, 2021 Health Committee meeting to order. We have all members present. So the next item then is the approval of our minutes from January 4th at regular meeting. Do I have a motion? Motion by Bloomfield, second by Chung. Are there any additions or corrections? Seeing none, Ms. Morlock, would you please call the roll?
Member Martin.
Yes.
Member Metzger.
Yes.
Member Chung.
Yes.
Member Johnston.
Yes.
Member Beer.
Yes.
Member Bloomfield.
Present.
Member Schaefer.
Yes. Thank you. That's been approved. And we do have members of the public. Is that correct?
Sorry for the delay, Chairman Schaefer. We do have public comment, and at this time, I am requesting that Chris Spanos come up to the podium and provide, he's going to read those public comments. Thank you.
Oh, okay. Thank you.
Good afternoon. We have 3 public comments or comments from 3 different people. I'll be reading the relevant portions and those portions that adhere to our rules with respect to decorum. The first comment is from Zachary Gittrich. I wanted to talk about the previous meeting. Previously, Camille Rodriguez said some things. I'm going to read it the way it's written, that frankly I found quite queer. She said that the county was not keeping track of how many county staff members had contracted COVID. Then she said, well, we are tracking it, but she couldn't tell you because of privacy laws. I find all this very confusing because I frequently FOIA the county for this information and they give it to me no problem. Why is it that duly elected county board members are unable to get information they need to make informed decisions, but some random long-haired, rabble-rousing miscreant like myself can walk up off the street and receive it within days? Don't the staff at McLean County technically work for the board? Is every county board member who wants some information the administrators don't like going to have to FOIA for them? It's preposterous, and anyone who disagrees is a Philistine. I say, a Philistine. Zach Gittrich. The next comment is from Bob Holliday of Bloomington. Dear Health Committee, first, let me be clear that I'm not blaming county officials for the vaccine shortage. That I believe in a failure of the Trump administration. However, I do blame county officials, specifically those with control over the McLean County Health Department, such as your committee, for making a bad situation worse. For instance, your health department tells local media that there will be a sign up on Thursday. It is at noon, 4 p.m., 6 p.m., midnight, ? Do we keep glued to our computers the entire day? Hy-Vee at least had the courtesy to tell me to go to its site at midnight. I did, and it was full by 12:10 a.m. I called the McLean County Health Department midday Thursday and followed the prompts for COVID information and vaccine clinics. I got a recording that, quote, Janet Hood's mailbox is full, wait for the attendant, close quote. No attendant, but it circled back several times to the first message. Do you really have only one person addressing COVID questions and vaccine appointments? If so, you need to make some management changes immediately. I'm 71 with several pre-existing conditions, and frankly, I'm angered by the haphazard way the vaccine is being rolled out by the McLean County Health Department. The last comment is from Sharif Shalky of Normal. I and many others are frustrated with the COVID vaccinations appointment registration system used by the MCHD. I spent all of last Thursday morning checking every 10 minutes, starting from 5 a.m., the MCHD link trying to book appointments for me and my wife in any of the 3 vaccination clinics that were promised for the following week with no success. Suddenly, by midday, only 1 clinic on February 3rd showed up on the link and instantaneously was reported as completely full. If this will be repeated every week, then it would be a stressful and time-consuming process that should be abandoned for a simpler system. I realize that the health department cannot plan long-term as they are only getting the information about allocated doses on a weekly basis. This, however, does not exclude redesigning the process to facilitate the signing in procedure. Just as an example, the Barnes Jewish Hospital in St. Louis procedure is simply that you enlist with basic information and they guarantee that they will contact you when it's time to schedule your appointment, depending on your eligibility and availability of doses, with details on where, when, and how to schedule your vaccine. For comparison, and after checking with many in our county who, like me, subscribe to the listserv of the HD, I discovered that none of them got any feedback since receiving the initial acknowledgement of subscription. I know that vaccines are in short supply and the state and county has little influence in determining how much does all allocated to them, how much doses are allocated to them. My concern is not to speed the vaccination pace, but to streamline and simplify the process of scheduling vaccination appointments in McLean County to make it less tedious and more transparent. Thank you.
Thank you. Moving on to departmental matters. First up is Ms. McKnight, the Health Department Administrator.
Good evening. I have quite a bit actually to say about COVID-19 vaccine. COVID-19 vaccine is coming to McLean County in several different ways, one of which is a federal partnership with Walgreens and CVS, where they're providing vaccine to the long-term care facilities. McLean County Health Department has no control over the allotment. We don't know how many vaccine are allocated to the program each week, as that comes directly from the federal supply. McLean County Health Department has no control over the scheduling of these clinics. We've started receiving an email update weekly from IDPH about clinics held. The second way vaccine is coming to us is the state of Illinois is partnering with Hy-Vee pharmacies to provide vaccine to eligible phase 1 and phase 1A and phase 1B by appointment scheduled through Hy-Vee. McLean County Health Department has no control over the allotment of Hy-Vee that Hy-Vee receives. We do not know how many vaccine doses are allocated to the pharmacy. The doses do not come out of the state supply. The doses do come out of the state supply, but not out of our county allotment. County Health Department has no involvement in this vaccine delivery other than to promote these sites as another option for the public, as we have been asked to do by the pharmacy. This is the retail pharmacy partnership I've been speaking of for the last 2 to 3 weeks, saying that it was coming. The media release that was sent out by IDPH on Tuesday, the 26th of January, was received by the media on the same day that the local public health, myself included, received it. The third way is IDPH divides up the rest of the state allocation of vaccine doses received from the federal government and distributes to the counties based on population size. We've requested additional doses the last 2 weeks and indicated to IDPH that we can take more and we'll take Pfizer or Moderna, but we will only receive what IDPH chooses to and can fulfill. Early on during phase 1A, other factors were taken into consideration to determine weekly county allotment, including number of healthcare personnel in each county. IDPH communicates these weekly allocation numbers to the local health departments because they feel, quote, that we have the best sense of our communities. A little bit more about how this process works is that the health department is notified on Wednesdays by IDPH how many doses of vaccine we have been allocated for first doses for the following week. We've been having weekly calls with local providers in preparation for mass vaccination, things for open pods and closed pods since mid-fall. Our local providers make requests to the McLean County Health Department for vaccine allocation each week by Wednesday, and we submit the final order to IDPH that evening to directly distribute vaccine to those sites, to the McLean County Health Department and other providers. Two of these other providers are our local hospital systems. OSF made the decision to receive doses of vaccine weekly from this county allotment and contact their own patients age 65 plus based on their own set prioritization. Carl made the decision to partner with the McLean County Health Department to expand our current mass vaccination clinics other than the arena on additional dates and eventually alternate hours. First dose clinics for the following week are being opened on Thursdays after we have determined the number of appointments we are able to provide based on the allocations we receive. Vaccine shipments for the county arrive usually Friday afternoons, sometimes early the following week. We've been receiving around 1,900 doses a week for all the providers that we allocate to. A little bit about second doses. It's important to remember that both the Moderna and Pfizer vaccine are 2 doses given about a month apart. This means that not only are we accounting for vaccinating all of McLean County residents age 18 and over, but you can double that number as we're essentially vaccinating twice our population. We receive a survey from the IDPH, this could be Thursday, it could be Friday afternoon, to confirm the number of second doses we should be expecting to receive based on what we were allocated to our county 4 weeks prior. The shipment is scheduled to arrive sometime early the following next week. So clinic scheduling, we have scheduled 1 first dose clinic this week so far on Wednesday, because again, we find out late the week before if we're going to receive second doses. Until we get the second doses, our weekly allocation of first doses has to potentially account for second doses as well. Clinics are scheduled for Tuesday and Thursday of this week to provide second doses for those that were previously vaccinated the first week of January. Additional first dose clinics or first dose appointments may be added if we receive all the second doses needed or if we receive any additional vaccine. We wish to avoid what has occurred in other locations, such as appointments being canceled due to vaccine not being available. We're scheduling appointments because we want to avoid what has occurred in other locations, which is people have camped out waiting in line for hours and then been turned away because there haven't been enough doses. The Biden administration has said that they are looking to be able to provide the states their allocations for 3 weeks out. This would allow us to open up schedules and appointments further out than 1 week. The method for scheduling, initially we were using a program called Sign Up Genius to have people sign up for appointment slots. It worked very well for the phase 1A population clinics. Besides these initial phase 1A clinics, other targeted clinics that have used Sign Up Genius have been held on Friday, the 22nd of January for first responders at the arena, and Thursday, January 28th for phase 1A at the ARC. McLean County Health Department used a distribution email list for our phase 1A partners to help us schedule these clinics. A joint media advisory was sent on Tuesday, January 26th, between Carl and McLean County Health Department, announcing the targeted clinic for January 28th and inviting anyone in phase 1A that was not already on our email distribution list to contact the health department to sign up for an appointment via our website or the call center. Unfortunately, individuals on the phase 1A distribution list shared the links to the clinics with individuals that did not qualify for the targeted clinics. We realized Sign Up Genius was not a good option any longer and have since shifted to the IDPH EM-Track system. You're likely aware that for the first clinic that we use this for, so this Wednesday's clinic, The volume of use locked up the system and people were stuck in a waiting room queue. That is actually how IDPH has designed the system to function. I do want to take a second to thank our media partners who have been instrumental in helping us get information out to the public. In the last month, I personally have done 4 TV interviews, 1 town hall presentation, 4 weekly media calls, 3 additional radio interviews, and 20 daily media updates. And also have followed up on countless email or phone messages from the public and or the media. This also does not take into account the many posts our staff have worked hard to develop for our social media pages and the time spent by our staff making edits to our website, working with IT to make things more user-friendly. Many ideas and suggestions that have been forwarded on to us have been considered earlier on in the process. One of those is before we got to phase 1B, the public wanted a place to put their name on a waiting list to get notified when they were eligible for vaccines. That was the intent of the email notification system in Sign Up Genius. Unfortunately, it couldn't handle the volume of use that we received, and we've been working with county IT to explore other options for mass communication and still being able to hopefully use those individuals' email addresses that we have received in Sign Up Genius. Another idea that's been submitted to us is a single phone line for scheduling appointments. Unfortunately, without being able to open additional clinics, appointments are filling within minutes. We do have the call center available to assist anyone that is unable to use a computer to schedule an appointment, and we're continuing to work on that process. We also have a task force working on vaccine equity, and we're planning a town hall about vaccine hesitancy for later this month. We've also been asked a lot about the rural communities. In these regular calls that we're having with our local partners, we've identified several locations and partners that could help us with these clinics for open or closed pods when vaccine becomes more readily available and we're ready to expand current efforts. We've also been asked about our schools and how we're vaccinating teachers and faculty and staff. We have a new partnership with a local pharmacy that will work to schedule clinics for our districts. This, of course, will not be completed quickly until vaccine supply becomes more readily available. I personally have been asked why we aren't contacting all residents in McLean County over 65 with comorbidities like is being done in some other counties. The McLean County Health Department does not possess the data about this data about our citizens. This is what OSF is doing, what they've chosen to do for their patients using data from their own EMR system. This is not what Carl has chosen to do. I have talked with our neighboring counties just to find out what is happening across the state, and what I'm hearing from public health partners in other states. What we're hearing is everyone is encountering an issue of supply and demand. For every method that we try, there are pros and cons. There is no perfect solution. We have been at this response now for a year. I know the public is tired and we're all ready to move ahead. I do thank everyone for their patience they've shown us, and know that those who've reached out to offer us support, encouragement, and thanks is very much appreciated. Mass dispensing and mass vaccination are tools that have long been in the public health toolbox, but McLean County Health Department is not the be-all and end-all of vaccine delivery. And the design of mass dispensing and mass distribution is built for mass quantities of medicine or vaccine, not the limited quantities that we're seeing now. Earlier about other partners and additional availability of vaccine. We are getting the vaccine in the arms of McLean County residents as quickly and safely as possible. You also have my monthly report. As I worked on it, things were constantly in flux. And as you can see, since it was submitted for the packet, things have continued to change. There have now been over 14,700 McLean County residents vaccinated to date, and over 1 million in the state of Illinois. Are there any additional questions?
Thank you. Questions? Member Johnston.
Yep, the sign up list that people had done. First, I want to thank you. That was a very thorough, answered a lot of the questions that I had, so I appreciate that. Where people are signing up to get notifications, are we going to be using that for notifications at some point? I think that because they signed up, part of the frustration is that they didn't get anything when the clinics are being opened. And is there any way to standardize when the appointments will be kind of released? Because it feels like maybe and maybe that's my misunderstanding. Is there a standard time that the appointments are becoming available every day or every week? Or is that something that just sort of once we have the numbers down, then we release it?
So right now we've been opening up last week appointments on Thursdays, just based on the day we find out about allocations for the following week. That being said, we're encouraging the public to continue looking on our website and, being in tune with the local media as much as they can, because we will be announcing if we get extra doses of vaccine, opening up additional clinics or opening up additional appointments. So, that's a big positive if we're able to do that. And so I don't want to hold it for a certain day of the week, but Thursdays should be a day that we are consistently able to open up at least the following week appointment.
Right. But do we have a time, like 8 a.m., noon, nothing like that?
I would have people check in mid-morning. So around 11 o'clock, noon, mid-morning, just giving us enough time to get schedules built. And knowing also, again, that if everyone rushes at the same time, we could bog down the system.
Yeah, I think that's definitely going to be happening. But as far as like, what are the plans for using the list, the email list that people have signed up for? What are the plans moving forward to notify those?
So we're working with County IT right now to really get a system that has the capabilities to do what we need to do. So we had over 15,000 people sign up for that, and it's impossible to send that many emails at once. So we're looking at a communication system that we will still be able to pull the email addresses that we have received from Sign Up Genius and send them information through a different. So we're working on communication that we're putting out hopefully tomorrow, later in this week, just letting people know we signed up. We still intend to try to provide information, but some that we were using just was not. We have to take that it was not built for what we tried to use it for.
Okay, thank you. And then my last kind of comment would be, I know that you've been working hard on the website to try to update it. The page where the sign up is, to me, and I haven't looked at it today because I've been at work, but it has felt very cluttered and a little cumbersome to try to navigate, and wondering what we might be able to do to sort of clean that up to make it easier for people who aren't used to spending so much time on a website. So that's just kind of the feedback that I'm getting consistently. So I just wanted to pass that on, that it feels they don't quite know what they're clicking on, or so if we could try to simplify that and make it a little more user-friendly would be very helpful. So thank you.
Yeah, trying to send 15,000 emails will probably end up in everybody's spam folder because they wouldn't get them anyway. Any other questions? Member Chung?
Thank you, Chair Schaefer, and thank you, Ms. McKnight, for that, the whole of your statement. It's very helpful. I guess I have a few things I was wondering about. You said that so the thing that has been really pointed, I guess this is what I think has been, what am I trying to say? has been really made obvious by this whole system and the whole, how everything's been working out, is just the inherent inequity that's happening. Because if you don't have a computer and if you don't have email readily available, like say on a smartphone, and you're out, and then, other people are getting the notification, hey, you can sign up now, and then you can't because you don't have a smartphone or a computer nearby, that kind of, it breaks my heart, I have to say. I mean, I don't know how else to say that, but to know that vaccines and people aren't getting the vaccines that they need, the people who need it possibly the most, that to me is just I think that has been really put a spotlight on the sort of inherent inequity there is. So I would, if you could possibly say some more about this task force, I guess. I mean, I don't know when they're meeting, or have they met, or who's what they're talking about. If you can maybe possibly give any sort of ideas that people are throwing around. about how to help this out, because I did talk to a neighbor of mine who is very good friends with this elderly woman. She's 80 years old, lives on the west side. She is Mexican American. Her English is not great. She doesn't have a computer. She doesn't have a smartphone. She has comorbidities. She has, and she's 80 years old, and she is everybody in her family is worried sick about how she's going to get a vaccine. And I guess if you can maybe speak to that, because that's the one issue that has been frustrating, I guess, me the most in talking to people. So if you can maybe talk about this task force, that would be helpful. Thank you.
So the task force is really also involving some of our members of our public information team, and they've been out to community partners to survey them about the clientele that they serve. Have they reported that they have access to the vaccine? Are they hesitant to get the vaccine? If yes, why? Really also looking at location. So we know that we started with just the arena, and now we have another site that we're operating, and there are other sites that are operating, but we're also looking at being able to operate other smaller sites. So working with, again, this group of partners to have clinics that are in areas where access may be an issue. I look forward to the day when vaccine is readily available enough that people don't even have to make appointments. So we can completely eliminate that need. We're not there yet. So we're definitely talking through different options, and the call center being one of those ideas to be able to give people the opportunity that do not have access to a computer, they be able to call a number and have someone get them scheduled for an appointment. So, and we've got a town hall that's scheduled for next month. We've got a couple board members from the Board of Health that are really on this as well.
Did you have another question?
I
'Cause
do.
I was actually gonna, before you ask that question, I was gonna kind of help that your question to ask about the FQHC, because that serves a lot of that West Side population, I believe. And so if Ms. McKnight can make any comment about FQHC's bill.
So, our FQHC Chestnut is one of the partners that we are giving vaccine to, that are requesting that weekly. We have several partners now that are requesting vaccine of that 1,900 doses that we're receiving. So again, knowing that McLean County Health Department we can't do it all. So if we can spread that out and have more partners in the community that are offering the vaccine, that also helps ensure equity.
Did that help a little bit more, Sharon?
Yes, thank you. Let me see. I had a list of things. I guess my other question I have also, I'm just wondering if I know you said you're getting feedback and things. Is there any sort of survey, I guess, that's possibly being given out maybe to people when they're getting their doses or something? Because I am coming from the sort of viewpoint of, I'm asking questions because I just want to see what we can do to, everybody is trying to figure this out, but what we can do to make it more streamlined, because as we add in more vaccination groups, hopefully there will be more vaccines, but also I think that still, as we add in more people, it's maybe going to get maybe more complicated. I don't know. But I guess maybe if there's some sort of way to have a survey to find out if people, if they felt, I don't know. I don't know what kind of questions we can come up with, but maybe the ease of which they were able to make their appointment, how they felt that their appointment went that day, and this sort of thing. Maybe, I don't know if that's helpful, and that maybe that gives, of course, more work to do, but at least I'm trying to figure out what we can do as we move on down through, 1C and the next phase, next group 2 and everything like this, as we add in more people, what we can do to sort of make this experience as painless as possible for everybody in our community.
We definitely get a lot of very positive feedback at the clinics. So, but there is a time that they're waiting for observation, and that may be a time where they could do a survey, or a QR code could be an observation for people to do that as well.
Any other questions? Member John?
Thank you, Chairman Schaefer. Just two quick questions. You said there's going to be a town hall next month, but did you mean in March or did you mean in February? Because today's
Today's February 1st. Yep, so it's this month.
so when is the town hall so that we can promote it? Do you know?
I'll have to get the date for you.
Okay.
The 22nd.
The
22nd?
22nd. Okay. And then, oh gosh, what was the other question I was going to ask? Oh, with the state giving out the allotments and we're not getting as big a one based on our population size, I think even, you know, per capita, we're not getting the same amount as some of the other counties. Is it appropriate that we try to stick with what IDPH as far as opening up? Because I know that they went to from 1A and 1B pretty rapid succession. Is there any way that we can kind of hold it at 1A and 1B until that gets mostly done before we move on, even if the state moves on?
We're really going to focus on some targeted clinics over the next couple weeks to try to really hone in on, 65 and over, have some clinics that are targeted for our 1B population that we know is most vulnerable. But when IDPH started talking about going to 1B, it was that the entire state was going to 1B. And I know they allow that you can keep working, because we're going to keep working on they're in 1A, they're getting the vaccine. But it makes it very complicated and difficult when every county around you is now a vaccine clinic for 1C population when we get there, and we would still be vaccinating only 1B. So we will definitely, even when we get to 1C, probably still be having targeted clinics to get that 1B population. Like we did, again, we moved to 1B, but we had a clinic for 1A that was targeted.
Mm-hmm. Okay. I wasn't sure if we were required to follow what the state is doing or if we can kind of restrict that to make sure that we're targeting the most vulnerable populations first. We can do that?
Yeah. I mean, we can target, you've seen other counties where they've started with 1B fully and now have pulled back and they're doing, just 85 and over, just 75 and over. So we have that ability, but again, it is very, very challenging and very difficult when you have anyone around doing different.
Right. I understand that. Okay. Thank you.
Anyone else? Okay, thank you. That was informative. Member Martin.
I don't really have a question. I just want to throw a couple things out. A lot of people I know already understand this, that once the vaccine arrives, you only have a certain amount of time to get it into people's arms. And I share the frustration of the public. I share the frustration that Jessica McKnight is having. We're having the same thing at my location, my job. A couple of weeks ago, the state promised a shipment of vaccine, and it didn't show up for 24 hours beyond when we had a site scheduled with people scheduled to be there on a Wednesday. The vaccine didn't show up until Thursday. So it was quite a challenge to get that taken care of in that short of a time. So even though the state tells you that it's coming, you really don't know until it shows up at your door. So I just wanted to throw that out there so that the board members know it's not a smooth transition. Absolutely. Would you agree with that, Jessica?
I would, and again, why that our clinics for first doses, we almost have to account for those second doses out of that same allotment until those second doses arrive on our doorstep. That the doses that we are getting, they're going to have to count for everybody that we've got coming back this week until we know for sure. And then if we know for sure, that's great, and we're able to open up more appointments.
And I have to say that I received my vaccination Thursday, Thursday, and I wasn't quick on typing my name and getting in there at the right time. So I understand that also. But I did manage to get one after the other 3 dates were already full. So once you actually go through the process, you know, if you saw the setup at the arena, and I'm sure it's very similar at the ARC, it's very easy for them to be able to ramp up with many more once they get more vaccine, so we can run a lot more people through there. It was, I mean, it's pretty much a machine that they've got set up to run this clinic. So from having a little personal experience with it. Anyone else? Member Chung.
Thank you. I just had one more thought that I just remembered. I know that the IDPH had not, when they put the 1B, they had education and they had K through 12, I believe, and daycare workers and things like that. I do know that here in McLean County, we have a huge number of college professors and people who work at the college as staff. I do know that some other counties are possibly trying to like get college staff into 1B. I actually have personal experience with this right now. So I don't know if, I mean, once you had, before we move on, I mean, is there any sort of way that like you would maybe see that we could try and get a good chunk of our college staff and faculty vaccinated? Have you considered that at all?
Haven't considered it just because they don't meet the eligibility unless they meet it for another reason. So we do have to follow the IDPH guidelines for who we're vaccinating. So right now, IDPH says 1B is just, like you said, daycares and K through 12, unless again, someone who works for higher ed, if they qualify for another reason.
I guess, and you know, I know that at least I'd looked at the CDC guidelines. The CDC actually just said anything on education. And so I guess IDPH kind of decided to make it like narrow it, I guess. And I know that, I mean, I guess I was just wondering if there's any sort of thought that you could do that. There's just the thought that I had. And also since my husband actually works in Macon County, but he lives here in McLean County, and the university he works for is setting something up for all faculty and staff to be getting vaccinated. So I guess I do know maybe it's somewhat possible. I do know that Macon County is a little bit smaller than we are. And maybe they just have fewer people that are asking for vaccines right now in Group 1B. I actually don't know the situation there, but I do know that that's what they're doing there right now. So I just thought I'd ask to see, because I do know that a huge chunk of our population has to do with higher education. So I just thought I'd throw that out there. Thank you.
Thank you. So that's all on COVID and vaccines. Are there any questions on her other part of her report? Member Metzger?
I really don't have a question. I was just wanted to compliment her and her staff for keeping the wheels on the remaining pieces of the work that are continuing to get done. Everything from portable water to wells to private sewage to food inspection. That work continues to happen and is happening on a very, I think it's meeting the deadlines that have been set, the objectives that have been set. So as I look at this, I am continue to be impressed by, you know, the numbers aren't significantly higher, but they're still being able to be met. So I wanted to acknowledge the work that's being done outside of COVID. Not that COVID isn't important, but we're keeping the wheels on the other stuff. So thank you.
Thank you. Anything else from Ms. McKnight? If none, thank you. Moving on, we have, up next is Suzanne Scott, Adult Detention Medical. Suzanne, I know you're here. I saw you somewhere.
I'm here. I'm on the phone, but we really haven't changed much over the last month or so. I mean, we're just in a holding pattern. We continue to quarantine the people that are new when they come in. They quarantine for 14 days, and things are just in a holding pattern.
Thank you. Are there any questions for Ms. Scott? Member Chung.
Thank you. Hi, Ms. Scott. I'm not sure if you can answer this question or if it's something for the sheriff. I do know that in this vaccination group, what am I trying to say? That staff at the jail could also be getting vaccines. Do you know if staff at the jail are coming in to get their vaccines, or if people are refusing? Do you know about that at all?
I'm sorry, could you clarify the question?
Yes, I was just wondering if you know anything about staff getting vaccines. And I guess I could also ask, I do know that there was talk about possibly giving inmates vaccines too. Are you guys deciding to do that at all at the jail?
When our phase comes into play, we could potentially be what I assume is a closed pod. And as we were directed, we could give vaccines to our population using the staff that we have available. Our staff is vaccinated. Our medical staff, I cannot speak for the correctional staff.
Thank you.
Any other questions? If not, thank you, Ms. Scott.
Welcome.
Next up is Ms. Edens from the nursing home.
Hi there.
Hi. You have your report. I will let you start talking first before we get into any questions.
Okay. Well, like she said, we have the report. So if there's anything on there that you have any questions about, things are about the same. And we are just being perseverant. Very proud of my staff and moving forward.
Questions for Ms. Edens? Okay. Are we taking anybody yet? Any new residents?
Admissions, yes. We are thankfully down. We have one resident currently on our COVID wing and no employees positive. So we are taking residents now. We have a separate area for them as well, and they remain on the 14-day quarantine isolation and are tested prior to coming in.
Are all of the residents, have they had both doses yet?
No,
or they've only had their first dose?
Correct. Tomorrow is the second dose, and we have 97% of our residents have gotten the vaccine. Tomorrow they'll get their second dose, and I would say 50% got the first dose employee-wise, and then we've kind of bumped that up a little bit for the second dose, all of that 50% plus a few more now for the next one. So I think the word's getting out there that it's the way to go.
So the process has worked well for, them coming into the nursing home?
Yes, they come in and stay in one central area. We bring people to them and they give the dose. They sit for the 15 minutes to monitor to make sure no issues, and we take them back.
Great, thank you. Anybody else? Member Chung.
Thank you. And thank you, Ms. Edens, for, like you said, your perseverance in the staff. I know that it hasn't been an easy past couple of months for you guys. So thank you for continuing to do the work that you're doing. I do have to say, the one part in your report that I enjoyed reading was about the music therapy. I don't know if you know this, but I'm actually a professional musician. So anything that, when I read things like that, that just makes my heart happy. And so, and I guess whenever things open up again, if you want some live music, I'd be more than happy to come by and play some music for your residents.
Oh, they would love that. Yes, thank you.
Thank you.
Anyone else? Okay, thank you.
Thank you.
Next is Mr. Tab from Juvenile Detention.
Good evening. I have no items for action. I would like to thank Terry and her staff for the assist today. We are currently without a nurse. Her last day was Friday. We have been looking. So we'll continue to look and try and get somebody to replace her. But thank you to Terry and her staff for coming over and helping out today. Report is on 27 through 29. I'll answer any questions that you have.
Any questions for Mr. Tab? Member Johnston.
Thank you. I just had a question. When we upgraded the pay grade for the nursing home, we recently did it for the jail. Did that include the JDC as well?
Yes, we were able to increase the pay scale starting out.
Okay, so that should help. I'm hoping to get somebody to you as quickly as possible. Okay, just wanted to make sure that that one didn't get left out. So thank you.
Thank you.
Any other questions? Okay, thank you, Mr. Tab.
Thank you.
Next up is Ms. Rodriguez, County Administrator.
Thank you, Chairman Schaefer. We do not have any items from county administration to present for action this evening. Our report on recent employment activities is on page 30 of your packet, and I'd be happy to answer questions if there are any.
Any questions for the administrator? Okay, thank you.
Thank you.
Any other business or communication? Okay, because our next meeting is March 1st. We have bills and transfers. I'm going to take the transfers first because they're at the end of our packet. And I have been advised that Ms. Vasquez has said we could group them to the transfers all together because they're all end of year cleanups, unless anybody has an objection to that. So I'll entertain a motion for all of the transfers. Motion by Bloomfield, second by Chung. Any questions? Like I said, they're end of year cleanups. If not, Ms. Morlock, would you please call the roll?
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston.
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Schaefer.
Yes, motion passes. And then the auditor has approved and reviewed the bills, and they comply to all of our policies, ordinance, resolutions. And so first up, the nursing home has a prepaid total of $252,016.77. There a motion? Motion by Johnston, second by Bloomfield. Ms. Morlock?
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Schaefer.
Yes. The Board of Health has a prepaid total of $321,057.65. Motion by Chung, second by Metzger. Ms. Morlock?
Member Martin,
Yes.
Member Metzger. I'm sorry, Member Metzger.
Yes.
Thank you. Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Chairman Schaefer.
Yes. Jail and JDC Medical have a prepaid total of $119,405.29. Motion by Chung, second by Johnston. Ms.
Member Martin, sorry.
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Chairman Schaefer.
Yes. And the Developmental Disabilities Board has a prepaid total of $2,819.04. Motion by Johnston, second by Martin.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Chairman Schaefer.
Yes. And if there is nothing else, then I believe we will be adjourned. Thank you.